Hello and welcome to our special Q&A session on vaccines. We at Bristol Live have joined forces with NHS experts from across the city to answer your burning questions on vaccinations. Over the next 20 minutes or so, we'll cover everything from COVID boosters, the flu vaccine and more. But before we start, I'll let the panel of experts introduce themselves. So, Geeta.
Hi there, my name's Dr. Geeta Iyer. I'm a GP and I'm the Deputy Chief Medical Officer of Bristol, North Somerset and South Gloucestershire Integrated Care Board.
Hello, my name's Alix Towson. I'm a children's nurse and I'm the lead for Sirona, who deliver the school-aged vaccination programme throughout Bristol, North Somerset and South Gloucestershire.
Hi everyone, pleasure to be here today. I'm Clare Cook. I am the Access and Inequality Lead for Bristol, North Somerset and South Gloucestershire Integrated Vaccination Programme.
And I'm Pete Gavin. I'm the Senior Editor at Bristol Live, and I'll be asking the questions to the panel today. So we asked our readers to come forward with any questions they had on this issue, and then we sifted through the questions, and we've got the final few, and they're the ones that we're going to work through today. So the first question, this came from Brian. He asks, in the coming week, I'm having my COVID injection, but I find more and more pensioners around my age, which is 74, have decided not to have their COVID injections. Some of the reasons being they are always ill after their injection. Also, they no longer need it at our age. And also, they don't trust the vaccine, saying that you don't know what's being injected into you. So I'm curious to see what the experts think. So, Geeta, would you like to take this one?
Yes, happy to, Pete. So it's changed a little bit this season, this autumn and winter. And so the people who are eligible for a COVID vaccine have changed a little bit. So we are offering the COVID booster to people who are 75 and over, or those who are turning 75 before the end of January, to people who live in care homes, and to people who are immunosuppressed, whose immune systems are a little bit compromised by either a condition or a medication they are on. We do find that people sometimes say that they don't want a vaccination, and of course people are entitled to make a choice about that. We just need to make sure that they've got all the information so that they can make an informed decision. Older people are more at risk of serious illness if they do catch COVID, which is why we are still offering the booster to those who are older, over 75. So it is important that you have that discussion if you're not sure about it, or take up the offer of a vaccination when it is offered to you. Some people do get a bit of a sore arm afterwards because it is an injection that goes into the muscle, like a flu vaccine that people are offered every year. But generally, now that we've been giving these vaccinations for about 5 years now, we know that people tolerate them fine.
That's great, thank you. We've got a second question on the COVID vaccine as well. This one's from Christine. She says, I'm 67 years old with MS. Will I be able to have my COVID jab along with the flu one? So, Geeta, do you want to pick that one up as well?
Yes, that's fine. So we're able to give the COVID and flu vaccine together. Sometimes people choose to have them at different times, but we have tested this over several years now, and we are safely able to give both together. I would just say that MS in itself may not qualify a person to be eligible for the COVID vaccine. It might be down to the different treatments that you could be on with your condition. So it's best to check that with your specialist or your GP.
Great, thank you very much. Right, we'll move on to the next question. So Rachel asks, why is it important that young children get a flu vaccine? Aren't they the group most likely to recover easily? Alix, would you like to pick that one up?
Yeah, sure. So yes, on the whole, children do normally bounce back from illness quite quickly. However, not all children do, and there can be complications from the flu virus. So flu is a nasty illness. It's not just, feeling under the weather for a couple of days with a cold. It can leave children feeling really quite poorly for quite a long time. That results in parents having to take time off work, children missing out on their education. So there's that aspect of it. But it can lead to complications, and unfortunately some children do end up in hospital with flu complications each year, and some children do unfortunately die from flu complications. So it's not a given that all children will bounce back from flu, although, as you say, children on the whole can normally cope with the flu virus. It's also about protecting other members of our community, family members. So children, as we know, are super spreaders of the flu virus. So part of the idea of the flu programme for children is to try and stop that spread of the disease. So stopping it amongst your family members. You may have vulnerable members in your family, parents, grandparents, babies, toddlers within the home that may be more susceptible to flu. So stopping the virus spreading to them, stopping it spreading throughout the school to other children who may be vulnerable at school, teachers who may be vulnerable, and other community members as well. So there's a few aspects to it. It's about stopping that spread to more vulnerable people, preventing children losing time out of education and parents losing time out of work to look after them. But also, you know, as I say, not all children do bounce back quite that easily from flu. And it's about giving some protection and trying to prevent those children being really, really quite poorly and hospitalised.
Thanks very much, Alex. Okay, so the next question, this is one for you, Claire. James asks, what are we doing to address the imbalance in access to the flu and COVID vaccines between different communities locally?
Thank you, James, for your question, and a really key and very important question that you've asked here. So the approach of all vaccination programmes is to offer a very fair, inclusive and accessible access into vaccinations. And the way that we approach this is to ensure that we have multiple offers of how you can actually get vaccinations. And it's really important that we offer that locally, where people are, where they live, where perhaps they work, where people socialise. So there are multiple offers of how you can get the vaccine within your local community. And we want to really connect and signpost people to those local offers. So we have that information on a website called grabajab.net, and all this information can be shared. Also, we have communities, organisations across Bristol, North Somerset and South Gloucestershire that are working with the vaccination programme, who are also supporting signposting their community and to whether you can actually access the vaccine. So absolutely, it's imperative that we have that offer across. We have local pharmacies delivering, we have GP practices delivering, and we also hold outreach vaccination clinics embedded into local communities. Again, all that information can be shared with the links that will be on this chat.
Right, I'll move on to the next question. Becky asks, my child hates injections. Is the flu vaccine for children actually an injection, or can they receive the vaccine another way? Alex, would you like to take that one?
Yes, of course. Yeah, you'll be glad to hear for the majority of children, and the routine way of giving the flu vaccine to children is through a nasal spray. Very quick, very easy. It's like a teardrop size of vaccine up each nostril to deliver the vaccine. So that is the case for the majority of children. That is the recommended route. It gives the best immune response to that age group. So that is the default option. However, you can opt to have the injectable for children. The nasal vaccine contains a very small trace of gelatine. So for religious reasons, some people choose to have the injectable vaccine. So that can be arranged. And for another group of children who may be immunocompromised, severely immunocompromised, they can also have the injectable vaccine. So routinely at school, we do the nasal vaccines. At some schools, we are now offering the injectable. So at school for children with special needs, we'll offer the injectable vaccine. And at secondary school, for those older children, the injectable is on offer. But primary schools, because of the age of the children and the fact that they are there without their parents, we don't routinely offer that injectable vaccine in school. But we can signpost you and invite you along to one of our community clinics that we run regularly during the school holidays and at weekends, where you can be with your young child and we can do the injectable vaccine there for them. So routinely at school it's nasal, but there is that option to opt for the injectable if you choose to.
Thanks, Alex. I had a couple of questions that I was going to raise. The first one, in the US, a government advisory panel has narrowly voted that adults should not be routinely offered the COVID-19 vaccine annually, including those high-risk populations like the elderly. One of the panel members went so far as to suggest there was no evidence that the COVID vaccine presented serious infection. So this is a question for everyone, really. What do we think of that?
Shall I start?
Thanks.
So I think that as we've been delivering the vaccination across the world over the last 5 years, there is a huge amount of evidence, both about its efficacy and about its safety. We do know that the COVID vaccine prevents serious illness in vulnerable people. We also collect a lot of information on its safety. I would say that the World Health Organization has a committee on recommending immunisation and vaccination. It's got an independent advisory body. It recommends vaccination to different countries. In the UK, we have the Joint Committee for Vaccination and Immunisations. That's an expert advisory body that's made up of public health specialists, practicing clinicians, academics, all of whom evaluate the evidence and the recommendations and then make recommendations to the Department of Health about the best course of action to immunise our population. And I think that's the committee that we take our advice from. And in the UK, we've recommended that those who are vulnerable and who are at most serious risk of illness do take up the offer of the COVID vaccination. And yes, we're 5 years down the line. A lot of people have been vaccinated. This year, the people eligible for the vaccine are a smaller number because we know where we can focus now that the majority of people have taken up the offer over the last 5 years.
Right, so I'll move on to the next question. What's the best way for someone to find out if they're eligible for a flu or COVID vaccine this autumn? Has any thought been given to people who can't or don't want to or aren't even registered at a doctor's surgery? Claire.
Thank you, Pete. There are multiple ways to find out if you are eligible for the flu or the COVID-19 vaccination this season. Some of these will be online, for example, through your NHS app, or you can go directly to nhs.uk, get vaccinated. Again, you can go on there. They will also highlight on there where your nearest walk-in clinic is. Also, your GP surgery may have sent you text invites. Again, you can ask at your surgery what clinics they are running. Also, you can contact your pharmacy, you can book there, or you can walk into a pharmacy and ask. Again, thinking about people's accessibility around vaccine, if translation is required to be able to make a booking or understand where your local clinic is, then if you go to 119, also you can text. There's also British Sign Language Service, which will show a video of how you can access your vaccine. Again, we will put these details on this chat, so it's very accessible for you. So multiple ways on how to access your vaccine. For those that perhaps are not registered with any GP, then again, they can use these platforms going on the nhs.uk or phoning any of the helplines. And again, that will direct you to your nearest walk-in community clinic where we will be happy to vaccinate you if you are meeting the eligible criteria for this year.
A couple more reader questions here now. Whose responsibility is it to log any symptoms or deaths onto the yellow card scheme? If it's the patient's, why aren't we advised to do this? And if it's the medical professionals, why are we not told if this has been done? So, Geeta, do you want to lead on this?
Yes, sure. So anybody can fill in a yellow card. And for those who don't know what that means, it means you can report an adverse reaction or even a death as a result of a medication or a vaccination. And that then gets considered by experts to see if there are any trends, if this is a theme, if this is a recurrent thing that's happening, to then give more advice on future vaccinations and delivery of medicines. So anybody can record that. You can record it on behalf of somebody else if you want to as well. And yes, if you report an adverse reaction to a clinician, they can also fill in a yellow card for you, and they will tell you at the time that they are doing that. And that means that we can report back through to the patient if we've done that and there's been some feedback.
And the final question, Rach asks how much a doctor's practice is paid per vaccine given.
Yeah, shall I take that one as well? So the payment for general vaccines, and I'm talking about things like childhood immunisations, the MMR, etc., that's £10.06. And for that payment, obviously practices have to staff a vaccination clinic. They've got all the usual overheads in terms of heating, lighting, etc. But also there's quite a lot of build up to that vaccination clinic. There's contacting people, booking them in, making sure people are reminded about their appointment. So there's quite a lot of extra administration that goes on around that clinic for that payment. For COVID vaccines, the payment's actually slightly less, and it's £7.54 per vaccination. This can be augmented, and it has been augmented in the past by a couple of pounds on top if we have been delivering the vaccinations in a sort of a more outreach setting. So if we're going out to our patients who are housebound, then we can get an extra payment on top of that £7.54.
That's great. Thank you very much, Geeta. Right, so that's the final question. Has anybody else got anything they would like to mention? Or Alex?
It's worth mentioning, Pete, about children who aren't attending school and how they can get their school-aged flu vaccines.
Yeah, that'd be excellent.
So although our main route of delivery for the flu vaccines and teenage vaccines are through the school route, and that's where we see the majority of our children through that route and deliver the vaccines in school. If your child isn't attending school, for whatever reason, then you can access those vaccines through our community clinics, and we can hopefully share our details on how to contact us on here, but you can contact us directly and we can see you in a community clinic to deliver those vaccines for any children that aren't in school.
Pete, could I just come in with a final comment for myself and just really like to say to anybody out there in our communities, if you're still unsure in whether you feel confident enough to take your vaccine, whether that's flu or COVID, please, do speak to your local clinicians at your GP or your pharmacist. They'd be more than willing to talk through your genuine concerns that you may have and may be able to make you feel slightly more confident. But also, please do feel dropping into one of our local community sessions. We have staff available who would really talk through some of your questions, and even if you don't then go on to a vaccine, they will be there to support you with that decision, and you may feel more confident in making that informed decision, as Geeta mentioned earlier. So lots of places that you can seek that advice, and I would really welcome you to come along and talk to us. Thank you, Pete.
Right. Well, look, thanks so much, all of you, for taking the time. It's been really, really interesting to talk through this, and there's lots and lots of great information there for all the viewers to take on. So thanks very much again, and we'll leave it there. Thank you.